My name is Francesca Fawkes. I'm a senior physiotherapist in hand therapy at Great Western Hospital. This is a short video explaining how to complete exercises which will help aid the recovery for the injury you have sustained to your wrist or hand. Once your consultant is happy that the bone in your wrist has healed, your cast will be removed. You may notice you have persistent pain, swelling and stiffness in the wrist and fingers. Pain can be controlled with over-the-counter medicines such as paracetamol, but you may wish to speak to your GP or pharmacist about this. Stiffness and swelling are common problems and will be helped by the exercises in the following video. Your hand therapy team will also be available to give you additional advice about how to help with some of these problems. Start with your elbow on the table and your fingers straight. Keep your large knuckle joint straight. Hook the tips of your fingers over as shown. This is called a hook. From the hook position, straighten your fingers forward, bending at the large knuckle joints. Bend from the middle joints of your fingers, aiming to touch your fingers to the palm. Finally, curl the tips of your fingers up and under, aiming to make a full fist. This exercise is called Tenodesis. It aims to restore the natural glide of the balance between the flexors and extensors of your fingers. It's a nice exercise to start with. Allow your wrist to flop forwards and your fingers will naturally open. Allow your wrist to extend backwards and your fingers will curl naturally in towards the palm. Place your wrist crease over the edge of the table and allow your wrist to drop down towards the floor. At 8 weeks, you can add an extra pressure over the back of your hand to give a passive stretch to this movement. Place your wrist crease over the edge of the table. Bring your wrist up towards the ceiling. At 8 weeks, you can use your other hand to add a passive stretch to this movement. Place your hand flat on the table. Gently slide your hand down towards the little finger. Place your hand flat on the table. Gently slide your hand down towards the thumb. There may be less movement on this side than in the opposite direction. To increase the backward bend of your wrists, place your hands together as in the video shown. Move your elbows out to the side, trying to keep your palms in contact. Sitting in a chair with your back supported and your elbow tucked into your side, turn your palm up to face the ceiling. You can use your other hand tucked underneath your arm to give you an extra stretch. Then turn your palm down towards the floor.